Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So I'm a certified medical coder and I'm working as a medical biller and auditor, and I'm also founder and lead CPC instructor at Medical Coding Club, and my new basic to advanced CPC course starting from Monday, which is October 13th, and it's a 2-month course, online course. If you are interested to join that particular course, please do text me on WhatsApp to get the complete course details. So today, as many of you requested, I have took a real world surgery CPT coding. I mean, it's a specialty operative report. Okay. So I'm going to break down the real operative note involving EGD procedure, and EGD is a very common procedure. Okay. So please do watch video till end because I'm going to use the surgical coding fee ticket, and I'll explain how to code the diagnosis and how to assign the procedure or identify the procedure, everything which is which will be there on the specialty coding. Okay, with the surgery coding, everything I'll explain. So please watch, and if you haven't subscribed to my channel, please do subscribe to my channel, and please do share with your medical coding friends. Okay, so I think last month I explained the ENM live chart coding. So today we are going to see. So today we are going to see, surgery CPT coding. So I have taken a report from Outpatient Surgical Center. So you must know the POS here, place of service for Outpatient Surgical Center. And then we have the details about the patient, date of encounter, and surgeon name and preoperative diagnosis. They have given as bleeding and dyspepsia. So these were the patient primary concern. Okay, then they have identified after post-operative diagnosis. It is they have given with the two condition. One is bicap procoagulation bleeding, arteriovenous malformation, proximal stomach, and the second condition is dyspepsia. So here, since they have diagnosed it as dyspepsia, you have to always consider it as functional dyspepsia. Okay, not you cannot take it as a symptom, but since they have listed under diagnosis section, final diagnosis section, you can code it as a functional dyspepsia. So later I'll explain what it is. So next procedure, the first procedure they did EGD with controlled bleeding. So EGD refers to esophagogastroduodenoscopy. Utilizing the scopy, they have access or they are going to examine the esophagus, gastro, and duodenum. Okay, so the first procedure they did EGD with the control bleeding, and the second procedure is biopsy. So totally in the session they performed two procedure, and they have used anesthesia MAC, monitored anesthesia care, and later they submit to the whatever the specimen they have took, that they send to pathology. Okay, so why I am reading all this? So whenever as a medical coder, once you open the real world medical record, you must read everything which is documented in the record. Okay, so then only you can extract accurate details of the medical record. So next comes to now, let's understand procedure in detail. Okay, so once you read the entire procedure, you can easily identify what are the CPT codes you have to assign, and how to apply the correct ICD-10 CM diagnosis, and the modifier usage if anything is there. So all everything you can able to identify only you read the documentation thoroughly. Okay, so you can just look into the procedure in detail. Patient was placed in a left lateral decubitus position and given the sedation. Okay, then they have used, and also they have monitored the oxygen level, and then they have used Olympus. It's a particular endoscope, type of GIF executes like a the company which has the particular specialty in the endoscope, and the fiber endoscope was gently inserted into oropharynx, and the scope was then passed down to esophagus into the stomach and the duodenal bulb. The scope was then pulled back into the antrum. there were irregular folds noted there, and CLO test biopsy was taken. See here, CLO test biopsy was taken. So biopsy they did from where is important. Biopsy they did it from antrum. Okay, location is antrum. From the location, from the particular antrum location, they took the biopsy and they did CLO test. Okay, so CLO test they'll perform in order to identify or rule out the H. pylori infections. Okay, and like it's an organism test, as I said, they want to, if H. pylori infection is present, it will in the detect here in this particular test. And then there was an AV malformation in the body of the stomach. Photographs were taken, and this was oozing. Then using the bicap coagulator. Okay, so bicap refers to here, uh, like the particular. This is bicap. That means bipolar. Okay, ionized coagulating electrode probe. Okay, bipolar ionized coagulating electrode probe. Okay, they have used this coagulator for a multiple, were undertaken until finally the areas were coagulated fully. So after coagulated, the scope was gently withdrawn up to esophagus, and yes, so this was the whole procedure now. So you got to know there were biopsy, and also they did the bicap, utilizing bicap they did the control bleeding also. Okay, so next, complication. You have to identify if any complications are there. So complication here they have given none. The procedure was well tolerated and patient was transferred to recovery and alert with a good condition following the procedure. Okay, so please, you can pause the screen and once again you can read the whole medical record. I'm going little fast because I have to cover the surgical coding fee ticket also. So now the last thing, the medical record is electronically signed by the doctor. So then it is a codable. The record is appropriate to code and push it as a final claim. So now we will come to our surgical coding fee ticket. Okay, so we will identify, so what is the diagnosis we have to assign for that particular chart, what is the procedure, and what are the modifier required, everything now we will understand. Okay, so firstly, let's identify the place of service first. So as I said, place of service was outpatient surgical center. Okay, so let me go back to place of service. Yes, so place of service codes are here. So if you check 22 outpatient hospital. Okay, on campus outpatient hospital. So outpatient hospital is nothing but, we are taking for surgical center. Okay, outpatient surgical center, you can code with the place of service 22. So let me give that. Outpatient surgical center, because outpatient hospital is refers to surgical center only. You have ambulatory surgical center, that is different, but now we need outpatient setting. So 22 is the place of service which are going to use on this particular client. So next we will identify the procedure code. We'll see what are the two procedure they did. So let me go back. So they did EGD with the control bleeding as well biopsy from the antrum. Okay, so let me guide you how to code the procedure. So I'll open my software. Okay, so here, as you all know, this particular operating report belongs to surgery section, and we are clicking on the surgery now. So you also know that under surgery, this EGD procedure belongs to digestive system. Okay, so you have to take the code from the 40,000 series surgical procedure on digestive system. So I'm going by index. So next, what is the procedure they did? Okay, so you know that they did procedure on surgical procedure on esophagus. Okay, so also the stomach involvement is there, but let me go and check the code under surgical procedure on esophagus. Okay, so yes, here is the code set for surgical procedure on esophagus. Under that, you have to verify what is the exact procedure. So they did, performed endoscopy procedures. So you have to take the code under endoscopy procedure on esophagus. So I'm clicking on this particular code. Here, if you see, under endoscopy which particular scope they have used. So we have procedure for EGD, okay, esophagogastroduodenoscopy procedure they performed. So you have to take the code from this particular series, click on that. So here you have codes. So navigate here. The first procedure, as you know, like there are two procedure. One is control bleeding and other one is EGD with biopsy, taking the biopsy. So first we will code for biopsy. So if you check under esophagogastroduodenoscopy, flexible transoral diagnostic procedure, and then therapeutic include submucosal injection and again endoscopic ultrasound examination. Okay, we have other procedure. The 43239, if you check, esophagogastroduodenoscopy, flexible, transoral with biopsy, single or multiple. Okay, so this is the code that we need. The utilizing esophagogastroduodenoscopy, they took the biopsy. Okay, whether it is a single biopsy or a multiple biopsy, you have to code the same code 43279. And also you have to check the scopy type also and the approach also. Flexible transoral approach. Here if you go back to the scenario, somewhere they specified it was a flexible and the route of administration is transoral. Okay, you can also find code for transnasal approach and also rigid scope. Okay, that identifications are very important. So since in this particular scenario I am going to take down the first procedure code or the biopsy code 43239. Okay, see here, uh, see, oropharynx, it means through orally they are inserting the scope. Okay, and then coming to the procedure, 432 432, what is the code? 39, I think. 43239 is one code. Okay, so let me add that. 43239, one procedure. Okay, and the other procedure we have, that is EGD, utilizing the same esophagogastroduodenoscopy. They are controlling the bleeding. Okay, so look for all the codes. 43255, esophagogastroduodenoscopy, flexible transoral with the control bleeding any method. Okay, control bleeding utilizing EGD. So this gives you the correct CPT code 43255. So 43255 is another CPT code for you. So let me add that also. 43255. Okay, these are the two procedure codes that we have on the particular operating report. I hope you are getting my points. Okay, so since I have used software, you may feel like how she is navigating the codes. So for that, I will also lead the code with the book. See, here is a esophagogastroduodenoscopy procedure, and below to this you can navigate. 43235 is for collection of specimen, 36 is for injection, 37 endoscopic ultrasound examination, 438, I mean 432238, it is again transendoscopic ultrasound guided procedure. And then comes to 43239 with biopsy, single or multiple. So utilizing EGD, they are taking the biopsy. Okay, so why I am not explaining from the book? Here you can find a short description. So you have to attach your standalone code and then you have to refer. So that's why I was, showing the complete description in the codify. Okay, so here you can see the complete information about the code. This 43255 says esophagogastroduodenoscopy flexible transoral with a control bleeding any method. Okay, and in the operating report they have specified this particular thing, no, Olympus. So you can just check the more information about this particular endoscope. So it will be like they'll it's a flexible type of endoscope and it can be inserted through orally. Okay, so this much detail I'm not going to discuss, but it's a common endoscope that they always list under operative reports. Okay, so next thing, so these are the two CPT procedure. We got it now. And now we have to assign an appropriate diagnosis code for the medical necessity. You can't simply assign some code, random codes here. You have to check for which purpose they did the biopsy and for which purpose they did the, control bleeding. Okay, that you have to check and accordingly you need to assign the diagnosis code. So now let's find the diagnosis also. So coming back to the diagnosis, look for the post-operative diagnosis here. So first one is bicap probe coagulation, bleeding, arteriovenous malformation, proximal stomach. So mainly the condition is bleeding here. Okay, bleeding is the condition. So we don't have a further specification. So I will tell you how to lead the bleeding code. And the second one is dyspepsia. So for dyspepsia, see here, for dyspepsia, 1 minute. See biopsy, they have took from antrum. Okay, because patient had a discomfort, mild discomfort. So for that, to identify what is the condition related to the dyspepsia, they are performing the biopsy. Okay, so that means you have to link the CPT, biopsy CPT with the dyspepsia code and EGD with control bleeding procedure with the bleeding diagnosis code. Okay, so let me check the codes. See here, we have before going to dyspepsia, see, we have two code with bleeding related codes. One is K31 So it must specify dysplasia of the stomach. So we don't have that specification stating that angiodysplasia, but we only have the information about the bleeding, which is nothing but hemorrhage, and where the bleeding is happening in the stomach. Okay, in the gastro there is a bleeding. So what we will do, gastrointestinal hemorrhage unspecified code we will take. Okay, K92.2 is the bleeding diagnosis code that we are going to put this on this particular code set. Okay, so for control bleeding I'm going to add K92.2 as my bleeding diagnosis code. So it specify gastrointestinal hemorrhage unspecified. Okay, this is the one code. And for biopsy, you are going to assign this dyspepsia code. Okay. So for dyspepsia, I can also show you that. See here, when you check the dyspepsia, we have the symptomatic codes also, and we have the, related to psychogenic. I mean, for related to other aspects also, we have the code. But since they have diagnosed it as a final diagnosis and they are not specifying anything related to F series, okay, here you can't code any code from R series. You cannot consider it as a symptom. Instead, consider it as a functional dyspepsia. Okay, code is K30. So let me add the K30 code also. So K30 you can code for medical necessity, which is for biopsy. Okay, so this needs to be linked with the appropriate diagnosis code, should be linked with the appropriate procedure code. Okay, that is the medical necessity. If you mismatch, or if it is nowhere related to the, if the diagnosis is nowhere related to procedure, means again the client may be get rejected or may be denied. Okay, and after coding this much, the one more thing you have to be aware about: ICD exclude one notes. Okay, so ICD exclude one notes here. Same way for CPT, you have to click the CCI edits also. So just a minute, please. This is the problem with the live recording. There will be disturbance. Okay, sorry guys. So yes, I was referring. So whenever you are coding two ICD codes on the claim, or whenever you code two procedure on the claim, you must refer exclude one node for ICD, and same way CCI edits, procedure to procedure edits for the CPT. Okay, so now I'm going to show you both exclude one and the CCI edits. So first, let me check regarding the procedure. Okay, just a minute. So for procedure, we have to check the CCI edits because two procedure we are billing on the same day. So you must also know if there is any kind of CCI edits involved in that procedure. So I hope everyone is aware about the CCI indicators. 0, if you get indicator 0, that means code are always bundled and you cannot bypass the edit even with the modifier. And if you get indicator 1, then there is an exception. You can build both the procedure utilizing appropriate modifier. Okay, so let's now check the CPT codes, whatever we are going to build. So let me check with 43239. Okay, 43239. So see here, we got the 43239 as a major code. That means 43239 is a column 1 CPT. And with this, you should check now. Will you be, no, you have to like, can we build 43255 with 43239? We have to check. So because with these two are the CPT codes we are having on the claim now. So yes, 43239 falls under major code, 43255 falls under minor code. And if you check the indicator, you are getting 1. That means allowed by utilizing the appropriate modifier, you can build these two procedure in a same session. Okay, so to bypass the CCI edits, you must utilize 59 modifier. Okay, for Medicare we use X modifier. Now we don't need because our insurance is BCBS. So I am going to use 59 modifier, and 59 modifier should be utilized with the column 2 CPT code. With a minor procedure code, I will add 59 modifier. Okay, with 43255, I am going to use 59 modifier so that I can bypass the edits, and both of the major and minor both CPT procedure code can be reimbursed because I am using the appropriate modifier. If I don't use the appropriate modifier, and when they fall under CCI edits, then the other one, minor code, will not be having the reimbursement. So it is very important to make sure the procedures are distinct. You have to use the appropriate 59 modifier on the claim. Okay, so I hope you got to know how to lead the NCCI edits also now. So yes, I am going to use 59 modifier here. Okay, with the 43255. As you see, 43255 falls under minor code, which is column 2, and which will have a little less RVU. Okay, so if you compare 425, 450, so it will, in the pricing as well, the RVU will have the column 2 will have a lesser one. Okay, but column 1 CPTs will have higher, which are extensive procedure and will have the higher value. Okay, so that is the info. So next comes to diagnosis coding. So under diagnosis, please cross check under any of these diagnosis coding, do you have exclude one nodes? So let me first check K92.2. Okay, we have the K30 code. Under K30, just refer you have K92.2 or not. So exclude one nodes. We have heartburn, nervous dyspepsia, neurotic dyspepsia, and psychogenic dyspepsia. And we don't have any bleeding code here. So one correction is, like we are done with the K30 now. So once again, for the cross check for under K92.2 gastrointestinal hemorrhage, check dyspepsia is there under exclude 1 or not. So you are seeing type 1 exclude 1 for K92.2 gastrointestinal hemorrhage. Under that, you have acute hemorrhagic gastritis and hemorrhage. So you can see here there is no dyspepsia code under type 1 exclude. So that means both of the codes comes under exclude 2 here, and we can code them together. Okay, so if any one of the condition has the particular code, then we would have not coded them together. But we did not find any exclude one node for the particular conditions. Okay, we have also cross checked, so both diagnoses can be built on the same claim. Okay, perfect. We got the CPT, we got the diagnosis, and I also appended appropriate modifier based on the NCCI edits. Okay, now quantity. So you know that they performed one procedure only, 43239. That means biopsy one procedure, EGD one procedure. So I'm keeping one unit, and insurance BCBS. Okay, BCBS going to reimburse this fees, and then the final. So the final $450 for 43239, 43255 for $425. Together I am getting 875. Okay, so this is the overall fee ticket. That's it. Okay, this is how you code the surgery CPT codes, which we say surgery coding. Okay, so surgery involves various procedures. It's not only related to digestive. You can get anywhere from integumentary to nervous system. Okay, from 10,000 series codes to 6,000 series, any procedure you may expect. So if you have a clear idea on everything, you can easily code the procedures. Okay, the only thing take time is to read the details of the procedure. and identify the diagnosis. And with the kind of with the procedure you may have little doubts, but eventually you can also get used to it. And with seeing various medical records, like you will, as I said, you will get more exposure, and you can easily able to navigate the codes and easily able to assign appropriate codes on the claim. Okay, so now this is the fee ticket that we have created now. So later what we will do, if we have any particular specific pair coding guidelines, we have to check. And it goes with a different kind of the project that you are handling. After that we are just going to submit the claim. Okay, so it's a easy thing only. So on this claim, you are seeing the insurance company as BCBS, and the doctor is the the one, the surgeon is signed the record as well. So ultimately this is your fee ticket. This exactly how it looks on the software. Okay, I hope you got a clear idea on surgery coding also now. And here sequencing may vary, okay, based on the specifications. But to give you an overall idea, this is it. Okay, so yes, that's all for today. And once again, you can read the procedure here and understand. And if you find it anywhere, like if you are unable to understand something here, then let me know. Okay, so I have, in this video you have learned the importance of place of service, and how to assign a diagnosis code, and the medical necessity thing, and the procedures. Okay, I have also navigated the procedures. And then also you got to learn exclude one importance, and NCCI edits importance. Okay, so as a medical coder, you must thoroughly check all of the compliance and regulations before you move to before you push the claim to submission. Okay, so if you want, if you really like this video, as I said, you can comment down. And if you can share, please do share with your friends. And I'm thinking to do the HCC video also, like the live chart HCC coding also. So after some days I'll cover that also. Okay, so far this is the chart that I wanted to explain. I hope you got a little idea on surgery coding. And whoever says surgery is difficult, I think you may have little idea now. So this is how the surgery reports will look like. So please take some time, and you can pause the screen, and you can take your own time to read the scenario, and you can also navigate the codes. Okay, so you can do it with your own time. Okay, yes, that's all for today. And as I said, my new basic to advanced CPC course starting from Monday, and already the batch members have listed. And if you are interested to join, you can just, as I said, please do WhatsApp me. So thank you guys, thank you for your support. And last week, October 6th was my birthday, and many of you wished me through Instagram, and that means a lot to me. Thank you all so much.